On Monday, I spoke to Territorians about the escalating threat of the coronavirus, particularly how we are protecting our remote communities. I can now provide an update on last night's National Cabinet meeting and the decisions that were made. Before I do that, can I just say thank you right now to the Territorians who are going above and beyond, our extraordinary healthcare staff working around the clock, people working in supermarkets to keep the shelves stocked, and many, many others who are putting their hands up in a time of need. On behalf of all Territorians, thank you. To National Cabinet, we made a number of decisions to protect older Australians living in aged care. There are new restrictions on staff and visitors. Anyone who's been overseas in the last fortnight, anyone in contact with a confirmed coronavirus case, anyone with relevant symptoms, anyone who does not have the flu vaccine, these people are not permitted to enter an aged care home. For visitors who do meet these requirements, visits will be limited to 2 people at once for short visits. These measures are tough, but remember why we are doing this. Our older Territorians need us to protect them more right now than ever before. The risk of not doing this is too great, the cost too high. National Cabinet also accepted expert health advice that non-essential indoor gatherings of more than 100 people should cease immediately. That is now in effect in the Territory. An indoor gathering is something in an enclosed space. It does not apply to essential activities like visiting a pharmacy, going grocery shopping, attending school or work. It does apply to venues like cafes, restaurants and pubs. 100 people is a lot to fit in a single room. This won't affect many venues in the Northern Territory, but it will affect some. And it will require some venues to make changes to how they operate. I understand that. So this morning I have authorised a $5 million business structural adjustment package. This will help local businesses who need to physically adjust their spaces to abide by the 100-person rule. It can also be used to help businesses establish or upgrade their online presence to adjust to the changes we'll be seeing in consumption patterns. More takeaway, more delivery dining. I have directed public servants to personally reach out to affected local businesses so they can access this fund and be supported every step of the way. Those phone calls, those conversations have already started. All businesses can apply, but my first focus is on the hospitality sector. I know you are hurting right now. I know it's going to get harder. We will be with you every step of the way. This package forms part of a larger economic plan I am releasing today. We know that this is a health crisis, but it's more than that. Yes, our economy is going to take a hit, a big hit. We can't completely avoid the virus. We cannot completely avoid the economic hit that is coming. We can't stop the hit, but we can make sure we still are standing at the end. We acted fast with Australia's first stimulus package, and now we are acting again. We are going further to save local jobs, to protect local businesses, and to keep the Territory's economy on the road to recovery. Today, my government is announcing the Jobs Rescue and Recovery Plan. This is a $65 million economic support package with three goals. Keep shop doors open, keep cash flowing, keep Territorians working. I'll run through the measures now. There is a $20 million business improvement scheme. This is aimed at helping businesses get customers through the door with upgrades and improvements. This could include buying new equipment, new shop fit-outs, and physical changes to attract customers. All eligible businesses will receive $10,000 to do this, and if they want to put in $10,000 of their own coin, we'll chuck in another 10 as well, because we know it will be spent on other Territory businesses and other Territory jobs. There is a $5 million immediate works grants package. Not-for-profits, community organisations, including clubs, will receive grants of up to $50,000 to undertake repairs and renos. And if you put in some of your own money, we'll match it for dollar for dollar as well. Again, this will go straight to Territory businesses and Territory jobs. We will invest $30 million in a home improvement scheme. The HIS is back. It's bigger, it's better, it's bolder, and it will be a jobs bonanza. To help families and businesses, we will freeze government fees and charges and electricity prices until July 2021. Every little bit helps. We know tourism has been hit hard, and it's going to stay that way for a while. So that's why tourism was the focus of the first stimulus package, and it's why we're helping them again today. Our marketing campaigns will now focus on our best customers, our closest customers, our favourite customers, Territorians. We will be encouraging Territorians to get out and explore their own backyard with a dedicated intra-territory campaign through the media. That's what we're doing. Why are we doing it? This is literally about jobs, not cuts. This is about saving people's jobs. The experts have told us the best way to save jobs is to get money into the pockets of Territorians that can be spent with local businesses. So that's exactly what we are doing. We know for this rescue and recovery package to work, it has to be targeted, timely and temporary. We have to go hard and early. But let me be crystal clear about this. If we need to do more, we will do more. We will scale up to save jobs. I will do whatever it takes to save jobs and protect Territorians from the impacts of the coronavirus. I'll take whatever measures needed to save lives, and I'll spend whatever it costs to save jobs. We will never know if we did too much, but we will know if we did too little, and we will know it forever. So there may be critics who say this is too much, how can we afford it? To that I simply say, we can't afford not to. Because we go down the path of cuts, we know what happens. It will kill the economy, it will kill jobs. Now will be the worst possible time to cut, and we're not going back to cuts. I thank the business community who have worked with us on the Jobs Rescue and Recovery Plan. It's pretty obvious from this package that small businesses had the biggest say, the loudest voice, as they should. They are the job creators, they are the backbone of our economy, so Labor is backing them. And we will continue to partner with the private sector and NGOs to protect Territorians as much as possible from the impacts of coronavirus. That's really important. We can't win this fight on our own. Our banks need to be more flexible in their dealings with local businesses. Our commercial landlords need to show as much flexibility as they can. The federal government needs to act again on stimulus to keep the economy ticking, and I understand they are doing that. I want to see more from Canberra on what we can do to help workers in hospitality and retail, the casual workers out there without the entitlements to support them. But the most important people in this fight, it's you, Territorians. Your local businesses need you, your economy needs you. We need you to buy local, holiday local, basically be the best local you can be. You are the front line of this fight. When you spend $1 in the Territory, you save a job. So let's stick together, let's work together, and together we will see this through. I'm going to start with Greg first and take all the economy questions. Once you're done with Greg, he's a busy man. He's the acting CEO of the Chamber of Commerce. He needs to get on with saving jobs himself. After that, we've got the Deputy Chief Health Officer here and the lead on COVID-19. So we'll then go to the health-based questions if that's okay. So we'll start on the economy side of things.
On the tradies package, is it sensible to expect that tradies are going to go round to people's houses in this environment where people are self-isolating to get works done in people's homes?
So this can be managed. There aren't that many people right now in the Northern Territory self-isolating. There are a lot of people out there who can qualify for this scheme. A significant amount of people out there, the majority of Territorians out there, who can qualify for this scheme and get this work done, get this money flowing through the local economy. That's something that we can absolutely manage.
Is there any talk of a voucher scheme for locals to spend in local businesses?
We need to keep scaling up what our response is, I think, and we've got to keep discussing ways that we can get money flowing into the local economy. We have absolutely received ideas from the hospitality and retail sector that we are considering. One of the big pieces of advice we got when we were in Sydney, get too mixed up, Sydney last Friday, from the Governor of the Reserve Bank of Australia and the Secretary of the Federal Treasury was around doing things right now to get the money out the door, but aren't administratively burdensome. So we've got to make sure we get that balance right, that's quick to do and you can scale it up. So I'll absolutely take that advice. I am also mindful of the fact that the Australian government has done stimulus, has done that $750 out, and there is money flowing through that mechanism as well. So we are mindful, we are taking those ideas on board, we are continuing to consult people about the things that we can do, but I want to make sure that what we deliver is spent, not banked, that gets the cash flowing, that it doesn't bog down lots of public servants in how you do the administrative side of things. It's actually easy to use and easy to deliver.
Is this money new money or is it being redirected from elsewhere, and if it's both, what proportion?
So 60 million is new money, 5 million for the business structural adjustment package. At this stage, it's been redirected from the repairs and maintenance budget of 226 million. So there's a small redirect. Most of this is new. Let's be really clear here right now. The budget is going to take a whack.
So
we're upfront on that. It's been tough. We are seeing a collapse in revenue. I think we'll be upfront about that. The nation is seeing a collapse in revenue. The message from Dr. Philip Lowe, the Reserve Bank Governor, was we have to act now. That is what we must do. And if we don't act now, we will see a much longer economic downturn that lasts beyond the 6-month time frame we're working to around the coronavirus. So the advice is go hard, get ourselves sorted for this 6 months so we can bounce back at the end of it. If we don't do that, we're locking in a 5 to 10 year economic low. That's the message to every Premier, Chief Minister and Prime Minister from the Reserve Bank Governor.
We were already in an economic downturn before this all happened. I've heard reports of shops in the city that haven't seen a single sale for 4 or 5 days. Is there a real prospect that we could be looking at a significant number of those businesses in the CBD closing as a result of what we're seeing with this coronavirus?
There are another Territorians done it tough for a few years and their cash reserves are low. So their ability to draw upon savings is pretty hard. To talk for the top end, for example, we've gone through our wet season low. We're about to have a high dry. And the reports of forward bookings was looking excellent. We're looking forward to a great dry. That's basically gone of the advice that we're seeing here around the coronavirus. So you're going to have a bad dry unless we get this money out the door and get this money circulating. And then you go into a low wet. So for a lot of businesses out there, they're now looking at what was a difficult 6 months, now going to be another difficult 6 months, and then the traditional lows of the wet season. That's why it's so critical for us to get this cash out and flowing. There are some Territorians out there who are already doing it tough. They were banking on what was going to be by all the bookings that we had and a superb dry season. I apologise, I'm talking for the top end in this example. I do acknowledge the centre as well. This is going to hurt. And that's why we've got this money out the door. We've got to do everything we can to save as many jobs as we can.
How much do you think it's going to hurt? I understand you're doing what you can, you're making commitments, but what's your estimation of the cost of this outbreak in economic terms?
The modelling I've seen from both our Treasury and the Australian Treasury has changed dramatically over 2 weeks. So right now, even the modelling I get today will change again, I reckon, in a couple of days' time. We're in a situation now where it's almost impossible to predict what the impact's going to be in GDP or GSP. We are living in unprecedented times. The advice I had from Treasury a couple of weeks ago when we first started thinking about how do we economically respond to the coronavirus impact parallel to our health impacts has changed. And I think it will keep changing. It's just difficult right now to predict the impact, apart from the fact it's going to hit.
Bill Shorten was saying yesterday that our leaders need to be absolutely upfront, clear, just give us the absolute truth. So what's the worst case scenario that's been put to you at this stage?
I think we've got to be careful about speculation, so I get that, but what we have seen around the country right now is if you get the message wrong, you see panic buying that isn't needed. And so you've got to be really clear and calm and make sure people are confident about what's going on. And that's what I want to say right now. You can be confident that we're doing everything we can about the health of yourself and your loved ones. You can be confident we're doing everything we can to keep you employed and the money flowing. We are looking after you. You are a priority, the health of you, the health of your loved ones, that you're in a job, that the business is open. That's what I can guarantee. I think we've got to be extremely careful about saying other things because it leads to speculation, and we've seen the consequence of that speculation. So you've got to be extremely careful that you don't encourage panic buying or other things like that. By being upfront, 6 months we're working towards. That's what we're working towards, a 6-month time frame. I think we've got to put in place measures, which we've done so far, that can be sustained and maintained over 6 months. And you've got to make sure you're working with Territorians through those 6 months.
You've done a tourism and a business stimulus. Are you going to do a health stimulus package as well? Because other jurisdictions have really ramped up their spending on health, and that can help the economy too.
We have a significant health budget with lines against the measures that we're working on. So apologies if this is a sort of a government department heavy answer. So 7 out of the last 8 years, health overrun their budget. They have lines dedicated to the work that we're currently doing. We're working with them about making sure that they've got the money they need and they can do what they need. Absolutely. And we were given a leg up in some respects on the rest of Australia when we did the right thing by our fellow Australians and stood up the Howard Springs Workers Village. So we got to see firsthand the impact of the virus and what we needed to do. We're able to do that. So I can give you a guarantee. Health will get what they need to be able to work in these circumstances. We don't need to allocate them new money. They've got budget line items that work towards this end. If I do, I'll do it. But right now, we can work with this, with our budget, with the people we've got, They are exceptional people, and we are doing everything we can and will do and will continue to do when it comes to health.
You say you're concerned about worst case scenarios. Experts have been out today saying the best case scenario is at the peak of the outbreak in 45 to 60 days, 100,000 new infections per day nationwide and 5 to 15,000 deaths. How many do you think of those are likely to occur in the Territory? What proportion? And could we cut them by isolating the Territory altogether?
Right now, we have no known community transmission in the Territory. We are ahead of the curve, and the significant measures we're taking as a nation help protect Territorians. We've gone beyond that with what we're doing in remote communities and the ban around essential service travel only, or the supply and maintenance of essential services. I absolutely think we need to discuss nationally general movement of people. We've had those conversations and we're discussing those transport issues. But let's be clear, we need freight in the Territory. We need to make sure those trucks keep coming with food. So it's critical that we have movement across state lines, and we have to keep working to make sure this country is running, and we will do that. I am extremely mindful of the fact we need to protect the Territory and Territorians, and I'll do what it takes. I'll have the conversations I need to have, but they have to be practical. I'm a big believer that you have to be able to explain what you're doing, you have to be able to implement what you're doing, and you have to be able to enforce what you're doing.
But freight aside, are you open to, do you think it's an idea worth considering, and has there been any discussions about the idea of actually closing our borders to people other than freight coming in and out of the Territory?
So this has been raised by a number. So the Aboriginal Community Controlled Health Sector, for example, has raised it. I feel with absolute due diligence, you've got to follow those things up. So at the moment, in many ways, we're building moats around remote communities with how we're handling it. The question is, does there need to be a moat around the Northern Territory? It's much easier if you're an island. We share state borders with Western Australia, Queensland and South Australia. There is a significant complexity in how you would even manage this, or if you could even lawfully do it. So for me, my focus right now, priority right now, is protecting our remote communities, and we are doing that. And that may be sufficient, but I believe you do whatever it takes.
So it's on the table?
You do whatever it takes.
The doctors of the Territory have said that
Can I just pause? Just 1 second. There's obviously got Greg here around the economy stuff. So if done with the economy, I can go and bring Di up and we can go to health.
Let's ask about the budget, Michael.
Yeah.
It's really, when this hopefully does pass in time, it's going to make for ugly reading in a year or two. This government, if it's still in government, is going to be severely hamstrung, is it not, in what it can do because of these stimulus measures?
Probably fair to say that right now I'm planning for a 6-month window, and that's what a lot of Territorians and Territory businesses are doing. I might actually ask Greg to talk at that point about how business is actually working towards the current situation. Territorians will decide if I'm here in a couple of years' time, and considering the rapid change we've seen in just simply 7 days, for me to say what budget decisions we'll make in 2 years' time, I think is crystal balling and arrogant. If I be blunt, like up to Territorians if I'm here, and we've got a lot of work to do in the next 6 months to make sure Territorians get to have that say, and so that's what we're doing. I'm just going to pass to Greg to comment from the business point of view.
I just wanted to ask if you think school closures...
No, I'm passing to Greg to respond to the other answer about what the business situation is and how business are planning around the next 6 months.
Thanks, Chief Minister. Obviously, from a business perspective, and before I answer the question, the Chamber of Commerce is very focused on ensuring business continuity by offering our services to members, but not only members, to the broader business community in the Territory. We all need to support each other at these times. So we'll be actively involved in the helplines through the Department of Business and so forth. Business itself is very focused and as has been pointed out over the last 2 or 3 years, been under significant stress. It's essential that we maintain employment of our Territorians, and through the coordination working together with Territory Government, we've suggested some of these packages. The business improvement and support one is a major one for us. It's the one that will allow business to invest back in itself through getting a kickstart. It'll allow local business to continue to trade and and support their employees, obviously combined with the housing stimulus as well. So we're taking this day at a time, very much like the health aspects of it, but we are planning to see this process out, and in response to the longer term concerns, you know, Territory business has always invested in itself when it sees the opportunities. We know major projects are coming, particularly through defence. We need to be ready for those. We need to be able to get out of the blocks of this quickly and get back into normal days. So we will be very, very active in making sure that we are ready for the larger opportunities when they arrive.
What about those smaller retail businesses, Greg? I mean, is there a real prospect we could see a lot of those close in the next 6 months?
Retail is certainly doing it very tough, and was doing it tough before the impacts of the coronavirus. We certainly acknowledge that. I think it's important to get some cash through these spending criteria out and about, so the federal one's a start there. We've spoken subsequent to the briefing this morning about the speed of getting the tradies scheme and the home improvement scheme up and running. There's already existing databases of businesses that qualify for that, so the sooner we can get those applications in and actually the money being spent, the quicker it's going to flow around the general economy.
Is there anything else on your wish list for those small businesses that's not announced yet?
2 or 3 things, and as the Chief Minister points out, you know, it's part of a staged approach. So we have, we're very, very concerned about the well-being of business. So that's currently our first focus. Secondly, will be to get that money out spending. If that's, you know, not happening quickly enough, we'll be certainly pushing buttons as we can to make that happen.
So nothing specific?
We had a number of items on the list, but you know,
Constructive conversations.
Yeah, very much so. Particularly around getting projects that are you know, able to hit the ground running. They're the ones that we need to get into. So you know, some of it is about more coming out of this than it is surviving it. We need to survive, and then we need to be ready to really grow.
And do you have a message, I guess, for Territorians as well who might be thinking about where to spend their money or would like to assist in some way?
Absolutely. I'm sort of seeing that you know, business is very much still focused on the health aspects of this, which is how do I protect my staff and how do I make sure that we remain isolated from it. But that'll pass, and we'll get through what infections we do have. In the meantime, I think we need to really look at this as almost business as usual. We don't have the cases in the community, so therefore we don't, as long as we're observing the health practices, let's get out and go to the shops and go to the restaurants and get out there and enjoy life as we normally do. Because right now we haven't got that risk.
Thank you. Thanks, Greg.
Michael, sorry, could I just take you back to the question I put earlier on about the best case scenario? Present time, there's been some reluctance from health authorities to engage with these points, but we've got modelers talking about it, we've got universities talking about it. The one thing we don't have is politicians talking about it. You're the leader, why won't you tell us, at the very least, what is the best scenario, best case scenario? What are we really in for here?
I've seen modelling but not predictions about what a flattened curve looks like, but that's no guarantee of what will happen. The actions we've taken are to try and prevent anything happening. So for me, I think it's dangerous if you get into hypotheticals, because that's what has led, in many ways, to some of the behaviour we're seeing, like panic buying, that's not good right now or conducive to public confidence. So we are planning and acting to reduce any risk to Territorians. We have not had community transmission in the Territory, and we are working very hard to maintain what is an excellent record of health in the NT. That's my priority, and going down the hypothetical path I think is dangerous and leads to behaviours that are not good right now. That's why it's important as a leader for me to say to people, we're doing everything we can to protect your health and the health of your loved ones. We're doing everything we can to keep you in work and to keep the money flowing, keep that store open. We're doing everything we can to maintain a positive, healthy, civil society, and that is my priority right now.
Do you think school closures are inevitable?
No.
We saw Bill Shorten said yesterday he pulled his own children out of school. What do you think?
Well, the best advice we've got has been very, very firm and clear from the Chief Medical Officer and the Chief Health Officers from around the country, is that schools are the best place for our kids. There's growing evidence about that out of international or other countries around what they've experienced with their schools. But let me be really clear though, any decision we make about schools and our kids will be based on the health of our kids. there are some impacts to making that decision. That will not change my decision. So I'm aware that if we close schools, then there'll be workforce impacts. I'll plan for that. That will not change my decision about what we do with our schools. It's the advice I get from our medical experts and what's in the best interest of our kids. And I want to say to all the teachers out there who are worried when we talk about schools, we only talk about the kids. We are always thinking about our teachers too, and that same advice remains. This is a really important issue though, a really important question. So I want to ask the Deputy Chief Health Officer to also comment on schools as well. Thank you, Guy.
So all of the global evidence is very clear that closing schools does not make a difference to the community spread of the virus. And in fact, children are safer at school. The spread amongst children is quite low, and the disease severity in children as reported out of China is quite low. We don't think that there is significant spread from children into the adult population. We think that children have really mostly escaped this pandemic. That's great. Our kids need to keep going to school. They need to have their lives normalised. They need to not have people catastrophising about what might happen with this virus. A lot of people, 80 to 90% of people who get this virus are going to have a cold, and they're going to stay home for a while from work, and they're going to get better. The ones that get severely ill will end up in our intensive care units. It's going to be like a really bad flu year. Okay, we did that in 2009. We did H1N1 swine flu. We had a lot of pressure on our intensive care units, and we managed. And we are planning to manage this no matter what happens in Australia to the best of our ability, and we have the resources to do it. We have slowed down the curve.
Are you going to take the advice of the 6 senior doctors who wrote to you, because your initial response to that was quite dismissive?
So what the 6 doctors that wrote to the Chief Health Officer did not have visibility of was all of the work that is already being done. So most of the things that they have very quite rightly suggested are already in train and already being done. Those are our clinicians at the front line. They are doing the best work that they can possibly do, and they, like me, they're worried. We're all worried, and we're worried enough to be working day and night to make sure that this does not happen in a way in which is uncontrolled as it has done in other countries.
So has
They
elective
seem to
surgery
think,
been
though, that
cancelled?
there's a lot of
Has
delay.
elective surgery been cancelled?
We are re-examining the effect of continuing elective surgery in the Northern Territory. There are 2 sides to this story. One is, do we stop everything now and wait for that first case to happen? Or do we use this time to get as many people through their elective surgery to avoid those people getting worse, becoming sicker, and at the height of when we don't need them to require emergency surgery, that they then present? So it is not a clear picture. When we say elective surgery, a lot of the elective surgery is necessary surgery. It needs to be done. Those people can wait, but they may not be able to wait the 6 to 8 months we'll need them to wait if we don't get them through our list now. So we are balancing the risks and benefits of doing more elective surgery now versus stopping that elective surgery. We have thought about that not only in the Northern Territory but across Australia. The best minds are meeting every day. They are looking at the risk-benefit ratio of all of these measures, and we are putting in place what we need to put in place to make sure we all come through this together. We're in it together.
Are you considering putting surgeons and anaesthetists at Katherine and Gove, and do we even have the capability to do that?
So we already do surgery in Katherine and Gove. Both of those places we have fly-in, fly-out services with surgical teams and anaesthetic teams, and we have local GP anaesthetists and GP surgeons in those places. So we already have that capability. Are we going to ramp it up in those sites? That's still part of the planning process, and we are listening to our senior clinicians to see whether or not they think that that is an appropriate way to go or whether we don't do it.
How many people can we have on respirators in the whole Northern Territory at once? We've got 30 in Darwin, I understand. What's capacity in Alice Springs, Tennant Creek, Millenboy, Catherine, etc.?
So we have a number of ventilators across the Northern Territory. Some of those are intensive care ventilators, some are anaesthesia ventilators, some are transport ventilators. We have ventilators in CareFlight, we have ventilators in the National Critical Care and Trauma Response Centre, and we have a whole lot of ventilators on order. So how many can we ventilate? As many as we need to in the Northern Territory. We are working on additional spaces and additional ways in which to increase our capacity. At a number limit on it. We are and have been the only intensive care unit for 2,000 kilometres in every direction for all of time. We are used to planning for surges and dealing with what comes our way without any backup. And we've done that over the years. We did the Bali bombings with 5 ICU beds. We did 20 ICU patients.
Are you really?
We did H1N1, we had 14 times the prevalence, where other states and territories had 4 to 5 times.
But it's one.
So we have done this before. We have this, and we will do it.
Are you really saying we can, you just said that we can provide enough ventilators to meet the need? I mean, that doesn't seem realistic given the numbers that we're looking at in terms of
So
spread.
the numbers that are being put about as best and worst case scenario are not the numbers that we are going to have.
Just looking at
The
other
modelling is based on overseas countries who did not put in the public health measures that Australia has put in early and aggressively. I can tell you that the outbreak in New South Wales is beginning to dampen down. They have that under control.
So
In Italy, it went unchecked and they closed the borders of the state it was in, and it caused an exodus of people across that border and throughout the country. So we are looking at the experience overseas. We also know that our health system is much better prepared and much better resourced than the Italian health system.
But don't
So
we
given
also
this is all under control, as you keep telling us, I've asked this question, James asked the question, it's important for people to have confidence in the system. Why don't you just tell us how many ventilators are available?
Because
How
we
many
have
are on
more
order?
coming on trucks
Tell
down the
us how many
road.
are on order.
I do not have an exact number. It is more than 50 ventilators across the territory already, and we will have more than that by the time we get the orders that the Commonwealth are assisting us with. That is not the question. The capacity to do this is not the question. We are going to flatten out the curve. We are going to have a controlled community spread in Australia that we are going to manage very, very well. And that is the best that you can ask for of your health system, of the doctors that are doing this, of the nurses that are doing this, and of the people that are pulling this plan together. We are doing everything we possibly can to be prepared and make sure that the community is safe.
The passengers who got off the cruise ship this morning, did they undergo any screening or testing like that?
The people on the cruise ship were being looked after by a doctor on the cruise ship who was continuously monitoring them. We had contact with the doctor on the cruise ship. Those people were all well, and some of them have now left to go to their home ports or their transit ports, and the rest of them are quarantined on the boat until they're ready to get on their flights.
How long are we expecting that boat to be here for?
So most of the passengers and crew, I understand, will be gone by tomorrow, and how long the boat takes to turn around and go wherever it's going, I don't know. It may sit there empty for a long time. It's got nowhere to go and no one to take anywhere.
How many
Travel's
tests?
been, sorry.
Go on, Nina.
Thanks. Travel's been restricted to remote Indigenous communities. However, the Larrakia Nation's been organising free buses to take people back to community. What is your comment on this? Do you
The
realise it?
safest place for people to be is in community. We want as many people as possible to go back to community and stay there before this virus is spread in the community in the Northern Territory. We think that the remote communities can be maintained as the safest place for people to be. We are saying to our remote Territorians, stay where you are. Don't come into town, don't travel around. We will look after you. We are making sure that all of those remote health plans and remote emergency plans are in place. Everybody is working together to make sure supplies are in place, supply chains are maintained, and that we can look after the health of those remote Territorians in the best way that we have always done.
Will we have enough staff to run both the Howard Springs Centre, the Palmerston Hospital, Royal Durban Hospital. I mean, we're already struggling to provide adequate services just between the Durban and Palmerston hospitals. How will we cope with having to run another facility?
So we are an innovative and agile workforce. We are looking at a whole lot of health professionals that either no longer work in the clinical space, re-upskilling into the clinical space. We have got people that are of non-health background doing the non-health work in health to free up the clinicians to do their work. And we are also looking at our nursing students and our medical students to assist in the way that they can assist in this response. In the Bali bombings, we used our medical students to help with our comms. You know, there are many ways in which we can have health professionals at all levels assisting with this response. And we've found in the past, because we've done this before, that everyone steps up. And despite our small size and our small health workforce, people resources don't ever seem to be a problem for us.
So how
Michael,
many
could we
extra
just have
is
a
that?
line feeling on opposition? Sorry, James, this is the last one.
All right. I understand that there's two people right now fighting over the job of opposition leader. I'm fighting for the jobs of Territorians. I haven't turned my mind to it. I assume at some stage I'm going to have to, but I've been working pretty flat strap on how do we deal with coronavirus, both from a health point of view and from an economy point of view. There's a lot going on right now that I am working on. We had National Cabinet till late last night. I feel for the PM, so it was a late finish for me. It was another hour and a half for him. He would have got out about 11 o'clock out of that National Cabinet meeting. That's what I'm focused on, Territorians, and how I look after their jobs, not who's in the job of opposition leader. All right, thank you.